Principles of orthodontics. So, what's the point? What does it mean? Orthodontics isn't just about having perfectly straight teeth, but it's about making the mouth function as best as possible. If your bite is misaligned, you can't eat properly, you can't chew properly, and you might be in pain chronically, even a little bit, and you don't know that you don't have to be. So it does correct any issues that way. As a dental professional, we are taught to look at these warning signs. The first thing we do is we check the bite. Are they a class 1? Are they a class 2? Are they a class 3? If they're not a perfect class 1, then that could means they need orthodontics either now or in the future. If their front teeth are pushing more forward, well, that's not perfectly straight. That's not a class 1. They might need ortho. Or what if their bottom jaw is pushed more in this way? Well, that's not ideal either. That is not a perfect class 1. A perfect class 1 is basically when the molar teeth fit into those grooves perfectly and the top teeth overlap the bottom teeth, but not too much. And it's just everything fits together nicely. Now, what orthodontics does is it basically moves the teeth into the position where they want it to be, but then you have to wait for that bone support to come back to mold around it to hold it in that new position. That's why braces take so long, because we can't move the teeth using appliances like braces and then expect the teeth to not just fall out, because we need to give it time for that bone to mold back to hold the teeth in its new position. If we move the teeth too fast, the bone doesn't know what to do and they go, I can't move this quickly, so I'm not going to move at all to hold the position of the new teeth. And then they fall out. So obviously this doesn't happen because in orthodontics, we know to take our time. That's why when somebody has braces, it doesn't take a couple months, it takes a couple years because things take time. The older the patient is, your bone support in your mouth has a memory. So the older the patient is, it might take even longer from start to finish for the braces because they're not a child where the bone is still moving, it's still growing. As an adult, it's pretty much done. So to tell the bone to move and then move back, it's like, wait, what? Why do I have to do this? It can still happen, but it takes even longer. So this is why things take so long, but it's absolutely worth it. And then you have to think of things like, okay, once the braces are done, let's say it takes 2 or 3 years, the teeth can move back a little bit. So the teeth can become crowded a little bit again. This is where retainers come into play. You can get a permanent retainer where it's cemented onto the front arch on the inside and then the bottom arch, the front teeth on the inside too. This will help to keep the teeth in its position because teeth move forward, they don't move back. So the front teeth need to be kept tight together for the rest of the teeth to say, okay, these front teeth aren't moving, I'm not going to move either. So you can get that permanent retainer, either the top or bottom or both, or a removable retainer that you have to wear every night or even sometimes during the day. This depends on the orthodontist. If they said your teeth were very difficult to move, they might want you to wear retainers every night and even during the day as much as possible, or every night for 2 years, or every night forever to prevent those teeth from shifting back. I highly recommend a permanent retainer. You don't have to worry about it. You don't have to take something in and out. You just have to make sure to clean it properly because it's cemented on the inside. It's a bar basically, and it's very easy to stain and get plaque and tartar within that bar. So you do have to clean it well with the toothbrush, and I suggest a water pick. They are fantastic to get right in there, but it's entirely possible. But if you have that retainer, then that means the teeth will not shift and your teeth will be perfect. Without the retainer, the teeth can absolutely shift. So that's just my recommendation. Now, what if you just have one tooth that's out of alignment? So your back teeth might fit together perfectly. You're a class 1, but just 1 or 2 teeth at the front are slightly misaligned or slightly crowded. There's something called Invisalign that you could get. So you don't need the whole thing with the actual braces, but you can get a clear retainer to fit over the teeth. And over time, typically it does take at least 6 months to a year to 2 years, kind of the same as braces in that way. But you have different clear retainers that you would wear every day, 24/7. You would only take them out when you're eating, but this slowly moves that one tooth back into its proper alignment over time. But this is a little more cumbersome because you have to go to the dental office often. Typically, it's every couple weeks for the first little bit, maybe at least every month to get a new retainer. Once that one tooth starts to move a bit, as you can imagine, the Invisalign retainer won't fit. So you need another one to fit in its place. And then once that moves a little bit, then you need another one. But again, it's absolutely worth it. Same with braces, though. You do have to see the dentist often because they will have to tighten them. They will have to change that wire that goes on the actual brackets and make it tighter and stiffer. And this can be a little bit painful, but again, it's absolutely worth it. So with ortho, there's many different things. There's even different appliances that I haven't even touched on, but there's different ways to get ortho. There's the braces or the Invisalign or appliances, depending on what you need to do to change your teeth. Sometimes if the mouth is too small, if the arches are too narrow, we need to expand the arch first, called a palatal expander. Or what if we need to move the top arch, but we don't want to move the bottom arch? Then there's different head pieces for that. So it's complicated, but don't worry, your orthodontist knows all about that and they can help you. So I hope this helped. Let me know if any questions, and I'll see you all in the next one.